Thank you for taking an interest in learning about the educational resources that go along with our Identify, Isolate, and Inform toolkit. If you have not done so, go to www.mypact.us to familiarize yourself with the other items in the toolkit. This tool is designed to be used in collaboration with the others presented in the series to create a comprehensive approach to the early identification, isolation, and notification of patients with or suspected of having a high-consequence infectious disease. In this video, we will focus on how clinicians can easily use the disease-specific fact sheet template along with some pre-made examples to help you create your own fact sheets. Additional educational resources are available to help you understand and operationalize the entire Identify, Isolate, and Inform algorithm. Let's take a look at the template. The disease-specific fact sheet is a great way to familiarize your staff with a specific pathogen who may have little to no experience with a high-consequence infectious disease. It includes a quick high-level summary about the pathogen, including signs and symptoms, relevant epidemiological risk factors, case definitions, infection prevention and control measures, and PPE information, to name a few. These sheets can quickly bring your staff up to speed on a given pathogen and have them feeling equipped in preliminary assessment in caring for the patient. Here we will go over 7 key sections you should consider when creating your own disease-specific fact sheet. These sheets should be descriptive, include critical need-to-knows for the clinician, and be to the point. First, we will start with the name of the pathogen which you are writing about, and relevant epidemiological risk factors to go along with it. Section 1. You will focus on transmission to persons. Section 2. You could use past known cases to help write your clinical description. Section 3. Follow each bullet of your III. Section 4. All relevant IPC information for the patient and staff should be included here. Section 5 and 6 can include length of time for results to come in. And Section 7, any links to the CDC or WHO who could provide real-time updates on certain pathogens would be good to add here. Now that you can create your very own disease-specific fact sheet, remember to routinely review and update them so that they remain current with the latest scientific guidance. It can be helpful to date the document so it is known when it was last updated. Now, let's look at an example of a disease-specific fact sheet. Here we'll go over an example of a disease-specific fact sheet to help you when you create your own fact sheets. Here is a sample Lassa fever fact sheet. Your fact sheets could be as detailed as you want it to be, but keep in mind, these fact sheets are intended to serve as quick reference guides for initial screening, assessment, and management. For this example, we have included an epidemiological review. This section would be important to update regularly if there is an evolving outbreak for the given pathogen. Once you have decided to use the toolkit at your facility, socialize it amongst your huddles, staff meetings, and operational calls. It is important that your staff see the Identify, Isolate, and Inform toolkit before you implement it within your workflow. It will allow for them to ask questions and become vested in using the tools provided to them and helping protect them and the patients. Also, get your stakeholders and leadership involved. The toolkit is editable. Go ahead and customize it to fit your needs. You can use the entire toolkit or just some of the items to go along with the algorithm. If you have any questions, you can ask them at mypact.us/contact/ on the website, and someone will return your query via email. Thank you for watching this educational resource. Please be sure to see the videos developed on each of the other tools in the series.